I am absolutely ecstatic at the number of people hepatitis C has brought into one room. Years ago, we may have one or two. My name is Fran Falconer. I am a hepatitis support nurse, and I work in the Central Island of Vancouver. I work out of Nanaimo, and I cover the region from basically Lake Cowichan, Duncan, up to as far as Bowser. And the role I play as a hepatitis support nurse is in education and treatment for patients affected with Hep C. So in my opening, I would really like to take this opportunity to thank the Salish people for letting us hold this meeting today. Hopefully I'll get that correct. If that's wrong, I do apologize. So I'm going to start with a few housekeeping rules. We have a very small room. We also have a very limited washroom facilities. So if anybody has the urge, please do go when needed. There's a washroom just outside the door, and there's also a washroom up the stairs to the right around the corner, but it is limited. Parking, I don't know where any of you found parking this morning, but do be aware that the parking over here is for staff, so be cognizant of the fact that you don't wish to obtain a ticket. We are providing food today. We have a light snack and coffee throughout the morning, so please feel free. This is an interactive seminar, so we want you to be comfortable, be interactive, and have some fun. So food at the back. We are serving a lunch. We are on a very tight time schedule, so please make sure once you've had your meal, make sure that we're being fairly tidy. We do use food safe guides in presenting our food. And also the other thing I'd like to bring up is confidentiality. We are going to be putting the presentations onto video, and we do have some presenters that don't wish to be videoed, so we will be cognizant of that. When speaking, your voice will go onto video, so if you have an issue with that, just please let us know. Okay. At the back, you'll find we have a gentleman back there by the name of Serge Valancourt. Serge is a liver recipient approximately 6 years ago, and he's doing incredible work with the donor program. So if you want, there's information at the back, there's donor cards available. He will be with us all day, and actually Serge is going to be one of our speakers at the end of the day. Also, there's information for HepCBC at the back. So there you go. Okay. So our forum today is with regards to care and management of viral hepatitis, a public interactive forum. What we're presenting today are the essence and the reflection of the need for change within our community. In 2004, the Canadian Consensus Guidelines were put out through the Canadian Association of the Study of the Liver, 2004. In 2007, the Canadian Association for the Study of the Liver put out consensus guidelines. In November, the Canadian Association met again to bring forward guidelines for 2012. Now, we're not able to bring forward the actual documentation of the guidelines because they are not published. But what we are able to do is to stress the concepts and the issues involved with the need for guidelines. So that's what we're going to be presenting today, the upcoming consensus guidelines for the management of chronic viral hepatitis. So welcome, everybody. Also, our agenda is full. What we have is a full, incredible day with some of the best physicians we have in our country. We have an excellent presentation for each areas. We have Dr. Mel Cratchton, we have Dr. Rob Myers, we have Dr. Chris Fraser, Dr. John Farley, and Dr. Guest Squire. So These physicians are absolutely phenomenal. I wish I had in my brain one neuron that each of these physicians has. I would be one very happy camper. Before I start, I would like to go back to HepCBC for letting us put on this presentation today. HepCBC, I'm very pleased to be able to chair for their meeting. HepCBC is a nonprofit organization. It is an institution in British Columbia. Many people will recognize HepBull. It's a magazine that was put out on a monthly basis to give information to patients for hepatitis C. This little magazine is one of the first things I pick up each month to find out what is new and up and coming, because patients with hepatitis C are very knowledgeable. The other thing that HepCBC has done is, way back in the days of the early hepatitis, and we're going back 15, 16, 17 years, the other thing that came out was an incredible patient-oriented Hep C. It was called the Peppermint Patty. Now, I go back in hepatitis about 14 years, and I was very lucky to be able to attend BC Centre for Disease Control's very first interdisciplinary viral hepatitis conference. And here I am, a little nurse from the NIMO, knowing absolutely nothing, taking my peppermint patty, yellow highlighted, walking into a symposium, and what did I see? A whole sea of peppermint patties, because back in those days, we were all in the same boat. So they're an incredible group. The one thing with HepCBC is they do so much with so very little funding ever comes to HepCBC. So for us to put this presentation on today, we are really very, very thrilled. So I think we should have a round of applause for HepCBC. Okay, so why are we here? What's the big issue? What is this hepatitis C? And what impact does it have on our communities and our province? And why do we need to deal with this issue? So I'm a real graphic freak, and pictures are worth 1,000 words. So if you notice on the screen, there's a famous epidemiologist. His name was Dr. John Last, and he brought forward a phenomena called the iceberg phenomena. And when we look at disease processes, what we look at is the iceberg. Hep C is, at this point in time, is at the tip of the iceberg. What is coming forward is what is under the surface. So I think it's a great analogy. Also, what it does bring forward for our presentation today is the ability for an acronym, ICE. What we want to do today is be informative and interactive. We want community as well as culture. When we think of hepatitis C, stigma is a huge part of what patients live with. So very cultural sensitivity. And E, what we're going to be looking at is the educational, and also we want to entertain. We want this to be fun and interactive. So we want lots and lots of questions from the floor. After each of our speakers, there will be 15 minutes to be able to ask questions. Now, we look at the phenomenon of the iceberg. We don't have icebergs in British Columbia. So the analogy that we're going to use is we cannot see the forest for the trees. So we have in this room, we have a very broad variety of people. We cover the spectrum. So we've put the issues into stakeholders. Who are the stakeholders in hepatitis C? So what we look at is one of my favorite philosophers, Aristotle, is the whole is more than the sum of its parts. And it is a very broad community, so it fits into. So, with our stakeholders, as far as today, if it was not for the vision of one particular person, we would not be here. And an anonymous quote, "Vision without a task is only a dream. A task without a vision is but drudgery. But vision with a task is a dream fulfilled." And this truly is a dream fulfilled. And I would like to acknowledge the stakeholder that brought this vision forward. So if Douglas Laird could please stand up, that would be great. Our second stakeholders, we also would not be here if it was not for the implementation of health from the pharmaceutical industry. So we have our sponsors for today. Official sponsors are Roche, Merck, Vertex, Gilead, and Janssen. So we thank you very much. There are other sponsors as well. We have Thrifties, who's been very nice to be able to present us with some food. We have shoppers out in Souk, or to provide our water for today. We have a Safeway as well. So many people have put forward to help put this presentation on. Also, at the end of the day, there will be a door prize, and that was put together by some of the drugstores who've been able to give us some presents to put together. So, I'm going to start with the stakeholder in general as a concept for patients. And I'm going to introduce you to Liver Boy. I presented back in 2004, and I used this concept to just bring forward. The Canadian Liver Foundation, back in the days, had brought forward a wonderful little pamphlet called 50 Ways to Love Your Liver. And I jokingly said, well, how about 50 ways to leave your lover? So here's Liver Boy. Now, if you notice the little bow tie on Liver Boy, we've dressed him accordingly for today. And I'm going to bring forward unusual, when you think of the concept of the iceberg, we're going to bring forward a concept of hepatitis C. See, we're having fun, aren't we? So here it is. The conceptualization of hepatitis C chronic disease management model from my perspective. So what we have at the present time is it's like the bow tie. We have patients that are undiagnosed. We have patients that have been misdiagnosed. We have issues with surveillance, prevention, and harm reduction. Harm reduction is new on our plate. Then we go to the treatment perspective, which is the core of the bow tie. At this present time, we're actually treating very few patients within our communities. And on the other spectrum, we have disease progression, patients that are heading on to cirrhosis and to end-stage liver disease. So in areas we're finding that there are gaps, there are issues that we need to address. So our patients as stakeholders. Patients, who do we treat? Back in the consensus guidelines of 2004 and 2007, it stated that all patients, no matter what the apparent state of their liver disease, should undergo evaluation to determine if therapy is appropriate. We are in a new paradigm shift. New treatment modalities are coming out, and one of the reasons we're here is we need to be able to access those treatments. So, other stakeholders that we have. And Stephen, if you'd like to take a seat at the front. Okay.
We can hear sound coming from the house speakers. Can someone turn the radio off?
Oh.
Not your speakers, no.
It's like a Walkman or something we can hear.
I'm not sure. Lawrence, do you think you could find somebody that might be able to turn that off?
You've done such a great job. We want to hear you.
Thank you. I'll carry on and then we'll try and deal with the issue. Okay, so one of our biggest stakeholders, who is very important, is our federal and our provincial government. And with great regret, we today do not have any representation from the federal or the provincial government. So what we've done is I'm going to introduce two members of HepCBC, Stephen Farmer, who is the president of HepCBC, and Cheryl Wrights is a volunteer who works with HepCBC. Cheryl's just going to announce some of the questions that have come forward. So Cheryl?
Is this going to work for everybody? Is it on? I'm not good with mics.
Okay, you can come up here.
Oh, all right, all right. I wasn't planning on speaking today, but at 7:08 last night, we did receive answers to the questions that we had asked of PharmaCare. So the questions are on page 3 of the Hep C Bull in everybody's red folder there.
So on page 3?
We asked PharmaCare some questions, and we were going to get some written response, and it did come in. I'd sort of given up, but it came in last night. So anyway, if you look at page 3 of the Hep C Bull, it says questions for PharmaCare. And the first question just describes the current standard of care and asks, do you know who decides this sort of criteria? Okay. Second question. Let's see. Second question, turning the page here. Hepatitis C treatment is moving to a multi-drug cocktail using patient-customized response-guided therapy. And these new cocktails were tested using sets of criteria, contraindications, and futility stopping rules quite different from the current standard of care. Am I, okay, is this better? Okay, thanks. Therefore, we anticipate changes in these areas. Who makes these changes and how? Third question. You mentioned that PharmaCare follows guidelines set by specialists. However, the Canadian Association for the Study of Liver recommends new consensus guidelines for the management of chronic viral hepatitis every few years, and BC PharmaCare has not yet adopted the 2007 guideline recommendations. And then I go on to ask him what deliberative body decides which, if any, of these specialist guidelines will be incorporated in British Columbia, and is its decision-making process transparent? Fourth question. Other current and upcoming tests and drugs may optimize treatment success and cost effectiveness. And there's some examples. What set of criteria are used to determine which additional tests and treatments such as these get covered by PharmaCare? Fifth question. As new drugs are added to the HCV treatment cocktail and the various treatments and protocols become more customized to each patient's needs, we may end up with a very confusing set of situations. For example, in which a patient may meet PharmaCare's criteria to have the standard of care part of his or her treatment covered, but not the protease inhibitor part, or vice versa. How do medical staff counsel a patient and ensure treatment will not stop in the middle in such a situation? Question number 6. BC patients with some diseases such as HIV, AIDS, and cancers do not have to provide PharmaCare with proof of considerable damage to their bodies, such as 1.5 times high normal ALT, before they can have their treatment costs covered. In light of the 2007 Castle recommendations that patients with early HCV and the least liver damage are the most likely to clear the virus, what is PharmaCare's rationale for this delay? And then I asked one other extra credit question, one related but very speculative question. Alberta has a Center of Excellence for Viral Hepatitis Research. Do you foresee a Center for Excellence for Hepatitis C in BC anytime soon? And this is what Mr. Robert Nakagawa of Pharmacare has replied. Dear Ms. Wrights, thank you for your email of February 16th regarding the upcoming HepCBC forum on the Castle 2011 Canadian Consensus Guidelines. As you are aware from our previous emails and phone conversation, Pharmacare staff will not be attending HepCBC March 2nd forum. However, I appreciate receiving your input regarding the current standard of care guidelines for hepatitis C treatment and their applicability to Pharmacare coverage. The Pharmacare review process is based on the receipt of a manufacturer's submission for a specific drug. You are no doubt aware that Pharmacare is currently reviewing both Boceprevir Vitralis and Telaprevir Incivec for treatment of hepatitis C as a priority review, and we expect to complete these reviews in the near future. The Ministry of Health makes Pharmacare coverage decisions by considering existing Pharmacare policies, programs, and resources, and the evidence-informed recommendations of an independent advisory body called the Drug Benefit Council. The Council's advice to the Ministry is based upon a review of many considerations, including available clinical and, remember this word, pharmacoeconomic evidence. Pharmacoeconomic evidence, clinical practice and ethical considerations, input from patients, caregivers, and patient groups provided through the Ministry's Your Voice webpage, and the recommendations of the National Common Drug Review, or CDR. I would note there are also several opportunities in the enhanced drug review process for stakeholders such as HepCBC to provide input and engagement with the drug manufacturers. Further, as part of the Pharmacare review process, drug review resource team reviewers include clinical specialists selected based on the review requirements of the particular drug submission, the expertise of the potential reviewers, and the conflict of interest information declared by the reviewers. The DRRT reviewers for Boceprevir and Telaprevir would be aware that the 2011 Castle Consensus Guidelines will soon be available. Regarding your question about new and in-development tests for hepatitis C, including genetic testing, this information is interesting. However, Pharmacare is a drug coverage program and laboratory testing is not part of its mandate. Regarding your fourth question about special authority criteria for coverage of interferon in combination with ribavirin for treatment of patients with hepatitis C, I believe this is an error on his part. I think he meant in combination with a standard of care in combination with the new treatments, but I'm not sure. It is important to state that treatments must be determined by a physician in consultation with a patient. The special authority criteria allow that, for requests which do not meet established criteria, exceptional cases may be considered, where the physician provides additional documentation of disease progression and/or other patient-specific considerations. These exceptional cases are reviewed by the specialists on the Hepatitis Drug Benefit Adjudication Advisory Committee. Your question about whether a BC Centre for Excellence for Hepatitis is being considered is a worthwhile one, although at this time a Centre for Excellence is not under consideration, given the high number of patients in the province with viral hepatitis and the important work being done by the BC Hepatitis Program at Vancouver General Hospital. Your recommendation is appreciated. Thank you for writing, and I appreciate the opportunity to respond. Sincerely, Bob Nakagawa, Assistant Deputy Minister, Pharmaceutical Services.
Thank you. Thank you, Cheryl. It was very important for us to be able to read that out, as they have been waiting for a response from PharmaCare for quite some time. What we're going to do now is Stephen Farmer is going to read a letter from the Federal Minister of Health responding to our conference. So Stephen, if you'd like to go ahead. Yeah, you can come up. Want to do it down there or here? Okay, that's fine. That's good. Yeah.
Okay. Hi, my name's Steve. I'm the president of HepCBC. One thing that Fran didn't mention was the amount of volunteer hours that went into making this conference, and I'd like to recognize three especially. That's Fran and Douglas Laird and Cheryl Reese did a tremendous amount of work on this. So could we have a big hand for them? Okay. So I'm gonna read this letter that was up on the board. This is from Leona. Oh boy, that's a tough. Aglarga. I should know that name. But anyway, I'm pleased to send greetings to all delegates of HepCBC Interactive Forum on the 2011 Canadian Consensus Guidelines for the Management of Chronic Viral Hepatitis. This forum provides you all with a unique opportunity to take a closer look at both the content and the implications of these new guidelines for viral hepatitis care in British Columbia. The Government of Canada acknowledges viral hepatitis as a significant public health issue, not only in BC and Canada, but also internationally. 1 in 12 people around the globe live with either chronic hepatitis B or C. To change this, we need a comprehensive approach that emphasizes prevention, treatment, and safe public health practices. The Government of Canada is addressing hepatitis, and we invest about $10 million a year in programs that focus on research and surveillance, care and awareness, and prevention and community-based support. The Government of Canada also supports global efforts to address viral hepatitis. We are providing funding to establish the Global Hepatitis C Network in Canada and supporting a resolution to recognize viral hepatitis as a major world health challenge. I commend you all and the organization that you represent on your tireless work to make a meaningful difference to those living with or affected by hepatitis. I am certain you are here today because you want to make a difference. Best wishes for a successful forum. Leona how do you say that last name? Leona.
Yeah.
And I just want to,
She's the federal government minister of health.
for the PCs, right? I just want to also say that the reason I'm involved in HepCBC, because I, like Serge, had a liver transplant 7 years ago, and realized at that time that there was a group missing from the education result, and that was the Joe public was not being properly educated, I felt, at that time. There's lots of groups that are representative, but really the common person was not getting the information they required to fight hepatitis C. So that's part of, that is really HepCBC's main objective, is to educate the general public on hepatitis C. Thank you.
Thank you. So, very, very excellent input.